Living Clean, Living Well is a presentation of the Canadian Centre for Abuse Awareness.
Welcome to Living Clean, Living Well, everyone. So glad to have you along tonight. Well, tonight we have one more tool for your recovery toolbox. It's in the area of addiction, but in many other different areas of our lives as well. In some circles, people find this treatment very acceptable. Others may find it controversial. I find it fascinating and extremely informative, and I hope that you do too. Tonight we have brought one of the foremost experts in the area of hypnosis and treatment. Dr. Georgina joins us tonight. Welcome to our show.
Thank you.
And Dr. Vera Tarman, our regular contributor, also the medical director of Renaissance. Hi there, Dr. Tarman.
Hi, glad to be back.
So I understand, Dr. Tarman, that you were a past student of Dr. Cannon's.
Yes, that's how I found out about her. Yes, I wanted to understand why my patients kept doing the same things all the time, even when they didn't want to. And if there was some way other than rationality that I could use to learn to steer them in a different direction. And then I heard about hypnosis and I found Georgina. Mm-hmm. Yeah.
So, Dr. Cannon, fill me in on hypnosis. What do our viewers need to know? I mean, we've heard about this for years, but in the area of addiction, and I know you do treat people in the area of addiction,
yes,
but you've made it very clear, it's people that are in treatment already, correct?
Only. I will not take people who are not in treatment. Because it's an addition to,
yes.
It's not an instead of by any means. Okay.
And she also teaches hypnosis at the University of Toronto. So I'm really excited about this next hour of exploring this. I mean, we all have to keep open minds, and you know what works out there, we're always searching for answers, and tonight this show is going to be very, very intriguing. So tell my viewers, our viewers, about hypnosis and what they need to know. I mean, like I mentioned, we know the word, but how does it fit in with addiction treatment?
Well, first of all, it deals with the subconscious mind, and we're all in trance at some point or another. Anything we do automatically, including the fact that I'm nodding my head as I'm speaking, how I pick up my coffee mug, anything that I do without thinking comes from the subconscious mind. So anything you do without thinking includes habits, patterns, and addictions. It's automatic. You go it without stopping and thinking it through. And the subconscious is like your blueprint. So what we do with hypnosis is access the subconscious, get the conscious out of the way, and change the blueprint. It's really that simple.
The mechanics of hypnosis. How do you bring people into a trance?
Into a trance in the clinic. As I say, most people are in trance anyway. When you're doing anything automatic, when you're watching a TV show, when you're driving, when you're dancing, listening to drumming, that's a form of trance. That bypasses the critical conscious mind. When you're watching a movie and you feel and you feel yourself in it, you get surprised, you get shocked, you cry, you're bypassing the critical conscious mind. You're not saying to yourself, this isn't real. You're just feeling. Feelings come from the subconscious. So you relax down. You don't have to relax down because we can do it in the emergency room, but you find a way of bypassing that critical conscious mind. So I might just tap you on the arm like that, and part of you is saying, what the heck's she doing? And while I'm doing that and you're saying, what the heck's she doing with your thinking, I'm talking to your subconscious mind. So it can be that simple. But in the clinic, where it's kinder, we relax you down and ask you to allow yourself to feel relaxed and open, and we zoom in either with the script or with regression work back to the root cause of the issue, which can be early life issues or it can be in another lifetime.
Dr. Tarman, I understand that you tried hypnosis. This is correct?
I did.
What was that like for you?
Well, the thing that I was the most interested in was doing a past life regression. And I didn't have a specific goal in mind other than just to see what a past life was. And one of the things that I experienced was, one of the memories I had was, and I don't know if it was real or not, it didn't really matter, I've always had a fascination for war stories. And I had this image of myself as a World War I soldier just about to get blown up and feeling the glory and fear and all that stuff. And I don't know if that was real or not, but it just captured right on that fascinated feeling that I have whenever I pick up a book. So it enabled me to see in a non-rational way some of my interests. Now, I don't know really.
I understand.
Yeah.
Yeah, and also I have a doctor actually who comes to see me, and he has migraines. He's tried medication, he's tried everything, and he finally came and said, "Could you help me with my migraines?" And I got rid of my own migraines through regression. So I worked with him, and he immediately went into a past life in a pogrom and was shot in the back of the head. He was a kid, young boy, and then from there he immediately went into another life where he was an artist in the Renaissance time, and was painting and licking his brush and painting. So the doctor part of him was still very much there. And he said, "I guess I gave myself lead poisoning."
With the paint?
With the paint. So that's how the subconscious works. It stores all of the memories that have ever happened to you back into the womb, back to the womb and beyond. So to find the source of an addiction, quite often we just regress back. And then if someone's in treatment, well, I won't take them unless they're in treatment. I work with them around stress, self-esteem issues, quite often managing patterns. So they might have to change their group of friends, for instance. So how do they do that? How do they feel more relaxed and able to do that? There's a lot of work that goes on around that.
Now, you talk about past lives. I know that you've really gotten into that area. Tell us about your book.
Oh, yes. My book was published by Red Will Weiser in October last year and went at the top on Amazon, which was terrific. It was terrific. And it's now selling worldwide and doing very well. I'm getting a lot of response back from it. It's really great.
It's called Return Again, How to Do Your Own Past Life Regression.
Yes.
So well done. And how can people find the book?
On Amazon or through my website.
Wonderful. And your website?
GeorginaCannon.com.
That's nice and easy to remember. Cannon with 2 N's.
Right.
Oh, we've got a phone call. Shall we start right off with the phone calls, and then we can still keep our conversation going? Let's go right to the phone calls tonight. Line 4. Harley's calling in from Alberta. Hello there, Harley. Welcome to our show.
Hello, how are you doing?
We're doing well. How about you?
Oh, I'm doing okay. I'm getting better. I just wanted to ask the ladies there a question about. I wanted to ask them a question. I was in a relationship with my girlfriend, and we totally loved each other, and I guess I couldn't commit to having a baby with her, and she's younger than I am, and I don't want any more children, and we went our separate ways, and I really love her, but I love her so much that I let her go. Well, we kind of, it was a mutual breakup, but I'm just trying to find an exercise, or I'm wondering if you can help me try to get past that.
Sure, you sound awfully sad. Yes, one of the things you can do through hypnosis, and you can do self-hypnosis. Are you prepared to do that for yourself?
I could try. I'd like to try it.
No, don't try. Just do it. So take a deep breath and take yourself into trance. Not right now, because you're listening.
Oh.
Take yourself into trance. Take a deep breath. Look at the spot on the wall in front of you. And as you exhale, just gently close your eyes. And then begin to imagine that you know where your heart is, your heart and all the love you feel for her. And then imagine her standing in front of you. And between you, there's a cord of love. And change the thickness and the heaviness of that cord into something much lighter and softer. So you send her love, but let her go. And if you do that, and you send her love and let her go, by letting the cord go, if you do that enough times, you'll find that the pain diminishes, because you're wishing her well, but you're not suffering. So you're breaking that cord, but you're doing it very gently and respectfully. Does that make sense?
Yes, it does. It really does, yeah.
Okay.
So how many times should I do this?
How often should he do this?
Oh, at least twice a day for at least 21 days.
And for how long each session? do you
Oh, it
think?
takes maybe 5 minutes per session, 5-10 minutes a session.
Good.
Yeah.
Harley, I sure hope that that is helpful to you. And thanks so much for calling in tonight and starting off our show. I thought that this subject matter would really grab our viewers from a wide audience.
Yes.
And it's so interesting to be able to talk about it from an addiction treatment point of view, but also from a life point of view,
Yeah.
because sometimes everything's just intertwined, isn't
It's
it?
all life. It's
It
all
is.
it's all life.
It
It's all
is.
living, it's all life, it's just different aspects of it.
Dr. Georgina Cannon is our guest tonight, along with Dr. Vera Tarman. We're going to take our first break on Living Clean, Living Well, but when we come back, more of your phone calls and more discussion with my panel. Welcome back to Living Clean, Living Well, everybody. Tonight, it's Sunday. We are live here on CTS. I'm Teresa Cruz, your host. We're joined tonight by Dr. Georgina Cannon, who is a clinical hypnotist and an author of Return Again. We just found out a best-selling author on Amazon, which is wonderful. Her book is called Return Again. And Dr. Vera Tarman's with us as well, and she is our regular contributor, also the medical director of Renascent. Tonight, we're talking about hypnosis. And I mentioned off the top of the show, some people term it as an acceptable form of treatment. Some people may not be too sure of it. Some could even say it's controversial. I always say let's keep an open mind and let's explore this. If you have any phone calls, any questions, just give us a call. That's what we're here for tonight. I'd like to continue on with our discussion on hypnosis, and perhaps Dr. Tarman, you could talk about hypnosis from a medical point of view and how it happens.
Sure. You know, the thing that Georgina just did there, with that, using that imagery of the bond between the man and the woman, it's such an interesting technique because, you know, a classic therapy angle might be to try to understand or use rationality, but can you kind of figure out and analyze your way out of this? But what this does is it circumvents that whole left brain type of thinking and moves into the right brain, which is more imagistic and more metaphorical. And that part of the brain is a part of the brain we don't access well, but it's powerful. And it just cuts through and in a way that certainly for some people is much more effective. I think hypnosis is a great tool that is underutilized for this type of thing. Yeah.
And Dr. Cannon, being very respectful of your clients, I'm just curious if you're able to, of course, no names or anything, but in the area of addiction hypnosis, have you made great strides? Have you been able to help people through this?
Oh, amazingly so. But again, only if they're in treatment. I will not take anybody that isn't.
Yeah.
One of the memories that come to mind is a young woman who came to me for bulimia, eating disorder, really bad, and she'd had this for many, many years, been in treatment a long, long time, and literally she came at the last resort. And as she was sitting opposite me, she was a tiny little thing, just, I can still see her in my mind, and I wanted to find out where it came from, excuse me, where it came from, where the need to let the food control her. And so I regressed her back, thinking that something might have happened to her when she was 2 or 3 years old, but she went like that into a past life. And she was a young boy on the side of a mountain taking care of goats outside a village. And her parents had died, so she was living with her uncle, or his uncle, who used to beat him unmercifully. So he didn't want to go home. So he spent a lot of time with the goats, drinking their milk and surviving that way, except in the winter, the goats were in the shed, but he wouldn't go home. He died on the side of a mountain, starved to death. And so we had to heal that. And that pattern of starving yourself to death was safety. that in his mind. He'd rather die of starvation than go and be beaten by his uncle. So he chose that as a safe way of living or dying. And he brought that into this life. So once we healed that, and she took it back to her treatment center, and they found it made a huge shift. And I never hear later, but I did hear that they found it made a huge shift of understanding and recognition that that's possible. It made sense because she'd been through every sort of treatment up to then.
Anorexia and bulimia, that's a great success story. Absolutely.
Yes.
And we talk about the addiction to food. It goes on the other side where it's control and you don't, you can't eat.
Yes, that's right.
Because that makes sense, right?
Yeah. And so I mean, what you're doing in hypnosis is you're accessing that huge unconscious in a way that we just simply can't with cognitive therapy or any of the other tools that we have.
The interesting thing is that most people don't realize that all hypnosis is self-hypnosis. And this is why I really don't understand people who I appreciate their point of view, who don't approve of it. Because people are in trance most of the time, as I mentioned a little earlier. And I can't hypnotize, nobody can hypnotize anybody against their will. You have to allow it. So you have to allow that hypnosis process to happen. And once you do, it becomes so easy. As the gentleman who phoned earlier will find out, he'll use it for a lot of different things. So he'll be able to use it to make his golf game better, for instance.
Are those techniques in your book, Return Again?
Yes.
Yes. So if people are interested in self-hypnosis, they could get that book as well. So what questions do you have about hypnosis and how it could play a role in helping you through some rough spots in your life? It's your turn. Let's go back to our toll-free lines. Line 4, Nadine's calling in from Toronto. Hi there, Nadine. Welcome to the show.
Hi, thank you.
Go ahead.
I just wanted a message for Dr. Tarman, actually, on behalf of the Homestead Girls. We just wanted to say that we really appreciate her coming in and helping us out through some hard times with our addictions and stuff. And we just really appreciate her teaching us new things and to deal with our addiction. We just wanted to say thanks, and we're enjoying the show.
Thank you. And as you recall, last week we did a hypnosis, didn't we?
Yes, we did.
Thank you.
Good.
Thank you.
That's great. That's nice.
Made her night.
Yeah,
you do your work, and you hope to the best of your ability that you're doing your work, but it's always nice to hear some reaction from people, huh?
Thank you.
That's lovely.
That's great. Let's go now to line 2.
One
We
of
say
your
a big
scripts.
thanks to Nadine. Line 2, and Steve's calling in from Kitchener tonight. Hi there, Steve. Have you got a question or a comment?
I spent a little time in jail in Calgary for something I did not do. My brother-in-law, he kind of drugged me and did horrible things. And my memory of all that stuff is fog. I like to go back because I'm thinking about writing a book about all this stuff. But my memory is fogged and all this stuff because I got accused of my brother did sexual things and it was horrible. And I like because I'm thinking about writing a book. And is there a way you get your memory back and all this stuff?
That's an excellent question, Steve. Hypnosis and trying to get memories back. Dr. Cannon?
As long as the brain cells have not been damaged in any way by alcohol or drugs or accident, then yes, you can get your memories back. You can't get your memory back, but you can get your memories back. You can remember what was.
Or if they have been damaged for whatever has gone on in someone's life,
gone.
can you get some of the memories back? Or
It depends on which part of the
fragments
brain has been damaged.
Right, okay.
Yes, I mean, Vera would know that better than I.
But if I can ask a question, if you don't mind.
Go ahead.
What about the idea of repressed memories, where the idea is that you're not wanting to remember because you're not ready to have the memory?
Right, but you
What
can
would
get
do with
those
that?
back.
Yes.
If the want is there, you can get them back.
I
That's
see.
how people get sexual abuse memories back. So sometimes they come into the clinic and ask, they got a flash, and they want to know what that flash is.
But would your brain let you have them if you're not actually, if somehow they assess that you're not really ready to have those memories back?
Well, they come in because they want it. So if they want it, then there's a part of the brain that already has decided it wants it.
Okay.
Yeah.
That makes sense.
Yeah. I mean, you can't force, again, you can't force anything.
Yes.
But if
that's a
someone
good
comes in and
point.
said, I had a flash of something that was uncomfortable, and I just got a flash of it, and I can't even put my name on it, but I want to explore that, and I
Yes.
say, about what age do you think you were? 3, 4. Okay, let's go for it.
Yes, yes.
So in answer to your question, Steve, it may be possible, so with hypnosis and trying to remember. Let's go now to line 1, and Dave's calling in from Midland. Hi there, Dave.
Hi, how are you, Teresa?
I'm doing good. How are you?
I'm good.
You sound good.
Yeah, I have a few questions.
Yes, please.
First question is, does this work for everybody?
If you want to be hypnotized and you have an IQ over 70 and you don't have a medical condition, yes, it will work.
An IQ over 70, why is that
Because
one of the
you
prerequisites?
you need focus. You need to be able to focus.
Okay, gotcha. All right, Dave, go ahead. You said you had a couple more?
Yeah. Now, you say you won't take anybody for addictions unless they're in treatment already.
Right.
Well, I'm almost 14 years into recovery.
Okay.
What do you mean in treatment? Like in recent treatment, or could it be somebody that has long-term sobriety?
But you just mean active addiction, right?
Active
Like,
addiction.
if
So
you're
if you've been in
recovery
for 14 years, then you're in recovery. So that would be fine.
Okay.
So it would work.
Well, then that just negates my next question.
That's okay. So was there any more questions, Dave, that you had about hypnosis?
Pardon me?
Was there any more questions that you had for Dr. Cannon about hypnosis?
There was just one more. I was just wondering if like finding out what the root of the problem is for your addiction, can that actually do you harm and send you back out into your addiction?
Excellent question, Dr. Cannon.
You regress. One of the things I would do is to ask your subconscious mind to go back to the time you first made that decision, or the events around that decision, and change the decision. Have a look at it from a different perspective, because usually it's when you're much younger. And in the case of smoking, for instance, some people make the decision at age 3 when they're watching their parents smoke and say, I want to be like them. I want to be a grown-up. So they may not smoke until they're 15 or 16, but the decision was made at age 3. So we go back to age 3 and they change that decision. So yes, we could regress back to the beginning, to the very first time you made a decision that seemed like a good idea. For instance, any time that there's a row or there's an argument or I get into trouble, anytime my dad gets into trouble, I see he takes a drink. That's a good thing to do, and you could be 2 years old and see that. That would be the decision time.
Did you have anything to add, Dr. Tarman?
No, I'm just really fascinated.
Yeah.
But, one thing I will say is that, you mentioned a self-hypnosis that you could do, but and nothing captures the actual experience of having somebody like you doing a hypnosis for you. So if you ever get the opportunity to do a hypnosis, do one. Like have one done to you, and Dr. Cannon is an excellent person.
Thank you.
I really enjoyed my times.
Thank you.
Dave, it's been great to hear your voice again. Thanks again, a long-time viewer of our show.
Great.
We just love Dave. Thank you so much for calling in. Let's go now to line 3, and Connie's calling in tonight from Toronto. Hi, Connie, it's your turn. You're on the show. Go ahead.
Hi.
Hi.
I'm a woman of 55. I've been sober now for 5 years. I started drinking when I was about 13. And I've managed to give up smoking also 4 years ago. But the problem is I've been having was I suffer from anxiety and panic disorder, and I've suffered from that for about 25 years. I've done cognitive behavior therapy at Ryerson, and I just finished that recently. But I've always been trying to do things to help myself with reading books, self-help books, listening to tapes, law of attraction, things like that. But I don't seem to be getting over my anxiety and disorder. Would hypnosis help?
Yes and no. Yes and no. It depends on what causes your anxiety, what triggers it. It depends. Sometimes people buy into the story. It's been such a pattern and a habit of being someone who is anxious that it gives you a reason for being who you are. And that's probably more in Dr. Tarman's area of treatment. I also refer my clients to a lot of homeopathy for anxiety. But absolutely, if we go back to the source of your anxiety, I'd want to know why you started drinking at 13. I mean, don't answer me here, but that's part of what the questions I would ask. And I would ask what happened before puberty. What was going on in your home? What caused you to feel anxious, nervous, scared, angry that you couldn't express? All of those emotions. Something happened that lodged that in your body, in your being, at a cellular level, that came out in a need to escape. And that's where we would go back to. I would never guarantee anything because I can only lead you to water, can't make you drink. But absolutely, I've helped a lot of people with anxiety. In fact, I have a medical doctor coming to see me right now for it.
Mm-hmm. It's a big subject
It's
here
huge,
on our show.
huge.
Yes, our phone
Yes.
lines always light
Yes,
up when we talk
huge.
about anxiety.
It is huge.
Dr. Tarman, did you want to add anything?
No, again, I'll have to say no. You're doing a great job.
Thank you.
No, that's good. That's fine because I always want to make sure that
Yeah.
that everyone's contributing. But yeah, so I guess Connie, what she's saying is, I guess anything's worth a try, right?
Well, it's
Give it a
more
shot.
than it's more than just trying. It's committing. It's committing to changing your story. And I'm not belittling the feeling because I've been there. I'm not belittling it at all. But when you have something permanent, like an addiction, and anxiety is part of a pattern, it's hard to change your story to become something else. So you have to be really committed to wanting to change your story. Does that make sense?
Absolutely.
Yeah. So if you're committed to change your story, then absolutely hypnosis will help.
Yeah, I mean, everything would change.
Everything
How
changes.
you see people, how you see things.
Of course.
And hypnosis would help you to brave that new world.
That's right. That's right. And because we make a new story.
Yes.
You make a new story, and we put that into the subconscious.
Yes, into the blueprint.
Into the blueprint.
Yeah, which is very powerful.
Yes, it is.
Yeah.
Connie, thank you so much for calling in tonight. Time for another break here on Living Clean, Living Well. When we come back, more of your questions and more comments from our panel tonight.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here, got a swimming pool, there's a gym downstairs. Other side of the fence, golf course, it's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call, we'll get right back to you.
Welcome back, everyone. Tonight we're talking about hypnosis and how it can help us in all areas of our lives, but specifically because we were a show about addiction and substance abuse, trauma, sexual abuse as well, because the Canadian Centre for Abuse Awareness is the proud presenting sponsor of this show. We're talking about how it can help us in a multitude of areas. My guest, Dr. Georgina Cannon, who is a clinical hypnotist and also an author of the book Return Again, and Dr. Vera Tarman. So now that we've set the table again for you, just a little bit of housekeeping before we get to our next call. A longtime friend of the show and a longtime sponsor of our show from Turning Point Detox, Tammy Francoeur, is having a very special birthday. So from all of us here, we wanted to wish her a very happy birthday, Tammy. And also, I wanted to tell you folks, a lot of shows go on summer hiatus, but not us. We are here for you. I'd like to just tell you about some of the wonderful guests that we've got coming up throughout the next weeks of the summer. We have got, of course, Dr. Vera Tarman, who is a regular contributor. You will see her here here once every 2 weeks. Don Slessor's coming back. He's always been a fan favorite. He is a terrific addictions counselor, very down to earth, great sense of humor, and he's always fun to have on the show. Maureen Brine, one of the major therapists from Intervention Canada. She is also a relationships coach. She is trained in imago relationships, if you know anything about that. She has always been very well received on the show. I finally nailed her down, and she is coming on the show. And so she'll be along with Rick Osborne and Marty Cosgrove, two old friends at this show. Haven't been on in a couple years, so it's going to be great to see them. And then Andrew Walton and Jim McKenney from New Awakening. So we've got a tremendous lineup for you. And tonight is one of those shows. I'm so glad to have you along. I'm so glad you ladies are here. Let's go back to those phone lines. Line 1, David is calling in tonight from Toronto. Hi there, David.
Hi, it's David here.
Hi.
I just want to thank you once again. I'm very grateful that Vera Tarman, I seen her on the show about a year ago, and I'm very thankful and grateful that she pointed me in the right direction. It's like God was working in the day when I needed him. You know, I went to Renaissance. I really enjoyed the treatment center. I battled the alcohol. I know I got the isms, but now I'm dealing my searching moral inventory, and now I'm hearing about this hypnosis, and I'm praying that maybe there's an answer, because there was a lot of sexual abuse when I was growing up, and I guess alcohol fueled it, I guess, when I was a young kid. And even now, my addictions that I'm dealing with now is the medication. Like, I went to the doctors, and then, of course, the doctors put you on medication, and now I want to deal with that there, and I don't know the avenues to go down from that point.
Doctor, you want to go first, Dr. Tarman?
Well, what are you actually asking about that? Would hypnosis help you?
That's what I was asking, is if hypnosis would help me in my condition, because like I'm ADHD, and are you there?
Yes. What medication are you addicted to?
They put me on oxycodone, and they also put me on Percocets, and then they put me on clonazepam and Ativan, and I stopped taking all those medications except for the Percs and the oxys, right? And I'm having a hard time battling that, and I'm praying, and I put them aside, and it's just, I keep reaching out. I go to my AA meeting. I talk to my sponsor, and he keeps saying, just pray. And I'm asking, would hypnosis help along the way?
You mean like to help you get off of the oxys and the Ativan, or even if you're on them?
I need to be abstinent. That's how I...
Well, I'm not sure that the hypnosis might help you get off of them, but I think what comes to mind first of all is that maybe you need to go back into treatment to get off of them. It's very hard to get off of those on your own. I wouldn't suggest that you do it on your own. And if you, so I would either get a counselor or go back into treatment and work on that. And then you might think about hypnosis after you've done that.
Exactly. For support.
And also to deal with, we've touched on it in earlier calls, but to deal with a traumatic childhood filled with child sexual abuse. Have you helped people in that area?
Yes, indeed. Yes, indeed.
So, it looks, from what I hear, David, it looks like you might need a two-pronged approach. Am I hearing you ladies correctly?
First, back into treatment.
The treatment.
Absolutely first.
Would it be possible to do hypnosis if you're taking drugs like that? Or my guess is it wouldn't be as effective as if you were...
It depends on how affected he is by the drug. If he's operating fully every day, going to work and doing all that,
maybe
should be fine. Yeah.
But David, it sounds to me like you're wanting to get off of these. So I would try to nail that one on the head first.
David, hope that that's helpful to you, and thanks again for watching our show. Hope that we've been here for you as well. And please, in the future, give us a call back. Let us know how you're doing. We were talking, ladies, earlier tonight, and something cropped up that I had no idea even existed. But the more we talked about it, the more it made sense. Emotional addiction. Would you ever think that there would be such a thing as emotional addiction? I didn't, but perhaps Dr. Cannon, you could explain what is emotional addiction and how people could identify it in their lives?
Well, if you know people who are drama queens, male or female, that's drama queens.
We all know a few. And we love them.
And they, what in fact happens is they get a hit of tumult, of causing trouble. They get a high from it. So even if there's nothing going on
and
that's
it's a
wrong,
real high.
It's a real high.
Yes.
If
for causing trouble.
It's a chemical high.
Yes, it is.
And if there's no trouble going on, if there's no trauma, they will make trauma. And we say things like, oh, you know Ma, she's always like that, or, well, my brother's always been like that ever since he was a kid. He always wants to be the center of attention. And we allow it. We don't realize it's an addiction. And it can be as damaging to families and to the workplace as any other addiction. Because if you have someone who is emotionally addicted and they are part of a team at work, they are very disruptive. They're the ones that start the rumors. They're the ones that like to throw a bomb in and sit back and watch it all happen. And then when it's sorted out, they go and do it over there.
And they get a high off of this.
They get a big high
chemical
off it.
high.
Yes.
Yeah, I mean, even something as simple as swearing.
Yeah.
Just, you know, I'm not going to curse right now, but I mean, the swear itself.
We would have to beep you. I'm so sorry.
Yes,
but we would. No swearing.
Gives a little hit of endorphin.
Really?
So, yeah, so
Yes.
crisis gives you an endorphin hit, which is like an OxyContin hit, or an alcohol hit.
Yes.
So when this is the reason why when people swear or have crisis, it's not enough to just do it once. You've got to swear 3 times.
yes,
and then if you really want to get because you're really mad, you got to swear extra more because you develop a tolerance. So people develop a tolerance probably to their crisis, and then they've got to really make it big. That's why a drama queen is so big. I mean, I like excitement, but if I'm not a drama queen, that person needs to have extra excitement just to get the level of excitement that I have with just.
And they cause so much trouble, so much trouble. And you hear about, oh, my mother-in-law this, or you know, one of my clients complained that her mother-in-law kept coming over to her house, cleaning all her cupboards. And she knows I hate it, and she knows it's going to drive me crazy, and she knows. So she was the one causing the trauma. I said, send your mother-in-law over to me. I won't mind.
Yeah.
I think it's great. She can clean my cupboards anytime she likes.
I've got a few behind you there.
So it doesn't matter.
So it wasn't the mother-in-law.
Not at all.
It was the daughter-in-law.
It was the reaction. You see, it's nothing. If I give you this, you don't have to take it. But if you take it and make a big complaint, it's the wrong color, and it should be this way and not that way, and suddenly it becomes a big brouhaha, that is the drama.
So I want to get back to these phone calls,
Sure.
but let's, how does it work in with hypnosis then, if you've got a drama queen in your life?
First of all, recognition.
Okay.
First of all, if they come in because they can't keep a job or they can't do this or the other, then there's a recognition of, I wonder about what you own of this circle. Which part of this, well, that part's my boss, that part's my co-worker, that part's my mother-in-law. Okay, so where are you in that circle? So that recognition, and then we start changing the pattern. First they have to recognize it, acknowledge it, and accept it, and own it.
So it's dealing with the drama queens and kings in your life.
Yes.
And you can use hypnosis with
Oh,
that.
absolutely.
And you know what? And that is essentially a 12-step process right there. Because step 4 is, where is my part in this? So once, and accepting that this phenomenon happens. So you've already got some of the steps. So for those of you who are, in a 12-step program, hypnosis fits very nicely.
Yeah.
So what would you do then next?
Well, what I would do is once they own it, I'd ask them to imagine their new story. How might you change that?
Yeah.
How might you handle that differently? So next time your mother-in-law comes over, in fact, phone her and ask her to come over and clean the cupboards. And how would you change that? Well, I find it invasion of privacy. Okay, so maybe if you set up at the time, what else could you do to feel comfortable with it? So what we're doing is retraining the patterning of, and then putting that in the subconscious mind. They do it first consciously, because they make a decision to do it, and then we put what they want to do into the subconscious mind.
Yeah.
It is an invasion of privacy, absolutely. It is. I get that. Yeah.
Oh, I would.
You don't, huh? You're smiling at me, but you're not agreeing.
No. If someone wanted to come over and clean my cupboards, I'd say, great.
It sounded good to me at the beginning as well, but I don't know how I would feel about that.
No, I think it's great.
Yeah? Well, I guess you just have to go through your cupboards and make sure that there's nothing in there that you don't want people to see, right? Not that a cookbook or anything would be a problem, but I don't know.
I don't think I have anything I don't care about anybody saying.
Yeah. Okay. Well, that's an interesting perspective. Let's head back to our toll-free lines. Line 4, let's go to Sandra, who's calling in tonight from Ottawa. Hi, Sandra. You're live on our show. Go ahead.
Yes, my question is, would hypnosis help with people that have severe depression? There are no addictions.
It depends on the level A of depression, and if it's clinical depression, if you're being treated medically. We have found in the clinic, and I'm not speaking medically, I'm only speaking from experience in the clinic, we have found that depression is often anger and sadness, the same coin, just different sides, of something that happened at a young age. So we go back and look at it through hypnosis, we do the regression back there, and we look at it from an adult perspective, and we make the changes to the memories. And it slowly, slowly, slowly alleviates it. But not across the board. If it's really deep medical depression, I'm very wary about playing with that. Yeah.
Sandra, did you have a follow-up question, or does that help you?
Just the one thing, there has been some talk that there may be some bipolar there.
Then I wouldn't touch it. I'm not trained as a psychiatrist. I wouldn't touch it. I personally would not touch it. And I would recommend, unless you go to a psychologist who does hypnosis, who knows what they're doing medically, that's different. But as a non-medically trained person, I wouldn't work with bipolar.
Yeah. Excellent question, Sandra. And I think this would be a very good time to talk about the difference between a psychologist and what you just mentioned.
Psychotherapist.
Psychotherapist, yes. I get all of those names all mixed up, but the difference between them.
The psychologist is a doctor who has been trained, I don't know, has been trained for 5 years. No, it's a psychiatrist. Yeah. A psychiatrist is a medical doctor who's been trained in mental health. A psychologist has gone to school for 5 years to learn to
Well, they've got their
psychology
degree
degree.
in psychology,
Yeah.
and actually, if they're in clinical practice, it's probably been closer to 8 years.
Is it 8 years?
Yeah,
Okay.
like the master's is 5 years, but you can't actually see patients at that level.
Okay, and it's usually along a line of Freud or Jungian or Adler or...
well, not so much anymore.
Not so much anymore,
Yeah,
okay.
but it's actually, it's expanded a lot. Like that's the base, and it's expanded since then.
Okay, brief therapy. And a psychotherapist is someone who has gone to school maybe for a year or two and learned some of the counseling skills and some of the background skills, which is what I've done in addition to that.
Yes.
So, yeah.
I'm very curious as to how you became interested in hypnosis and how it came into your life.
Oh, I was in the corporate world before. I was a journalist to start off with.
Oh.
In England and here, and then went into the corporate world and has always been interested in how what makes people tick. And I found that when I was in the corporate world, I'd be having lunch with a CEO of a major corporation, and I found myself asking questions and counseling him what to do with his teenage kids. Oh. You know, because I always ask my clients, what keeps you up at night? You know, when they're corporate guys, and I wanted to get to know them so that we could work well together. And I found that I was counseling a lot.
That's a great question. What keeps you up at night?
Oh, yes. Yeah. And I found I was counseling them a lot. And when I decided to get out of the corporate world, I thought, what am I going to do with my life? And I started looking around for something that would enable me to help others help themselves. My role, my goal is to help people find their magnificence. That's what I say, I do. So I looked around and turned down a lot of things, took some psychology courses and some training, and then discovered hypnosis and loved it because it's not me doing it, it's the client doing it. I just shine the light and help them get where they need to go. Basically, any good hypnotist knows that really the client has the solution, it's just we have to help them find it. That's what I loved about it. It empowers the client, and they then have a tool for life that they can carry with them. And I got very excited. This is now nearly 19, 20 years ago, and never looked back since.
Wonderful.
Yeah,
Thanks for
it's
sharing
wonderful.
that. That's great. Dr. Georgina Cannon is my guest tonight on Living Clean, Living Well, along with our regular contributor, Dr. Vera Tarman. We're going to take another short break, but when we come back, more of your phone calls and more interesting discussion on the topic of hypnosis.
Statistics state that it is likely you know a victim of abuse. It could be a friend, a relative, a colleague. It could even be you. 1 in 3 girls and 1 in 5 boys will be sexually abused before they reach the age of 18. Please give them hope. Help us make it stop. Go to abusehurts.com and give to the Canadian Centre for Abuse Awareness.
Welcome back, everybody. Tonight we're talking about hypnosis. A very interesting discussion. Before we get going, though, again, I just want to tell you about Recovery Wire magazine. They are also a great friend of our show and also our community. A very informative, edgy, but fantastic articles in there. Their latest issue is just out just now. So you've got your latest issue coming out. So if you'd like to give them a little reminder there on their website, they will send you out your free copy of Recovery Wire magazine. And Dr. Tarman, you're still a contributor for that?
I am.
Yes.
Yes.
Yeah, she writes some great articles. Dr. Cannon, I'm curious, can anybody be hypnotized?
If they want to be.
But that IQ of 70, right?
Yes.
Yes.
Yes, if they want to be.
And how many times did you try with someone before you go, I'm sorry, but it's just not going to work for you?
Well, what usually happens if they come into the clinic and they're sitting with me and they're having a hard time letting go, I might say to them, you know what, why don't we call it a day today? Let me give you one of my CDs to take home and practice at home, get used to my voice, get used to doing it, get used to relaxing, and then come back. And
it happens.
It happens, yeah. Because there's a certain amount of fear. People have a strange idea of what it was going to be, that I'm going to take over their brain or something. And of course, it's not true. But they have to feel comfortable and they have to allow it. Because you can't hypnotize anybody against their will. So it has to be real.
Yeah.
And theirs.
And Dr. Tarman, the science behind it, what would you like to add in that area?
Well, there's a couple of things that you were talking about that that have brought me my interest in and continuing interest in hypnosis. And one of the things that is really clear is what we call the placebo effect in the medical realm. The power of the mind, the power of positive thinking, and the power of the mind. If you can will yourself to not feel pain, but you have to know how to do it, and hypnosis gives you the tool. But you can actually not feel pain in surgery, in childbirth, in a dental procedure, if you can learn how to do it. So it's a wonderful tool. And the other thing is one of the things that we're discovering now, especially with PET scans and new scans, is that you don't actually have to do something in order to have the neurons fire and wire together. You just have to imagine it. So that a person who's a paraplegic, for example, no, forget about that. A person who's wanting to practice a piano or something like that can't actually practice, but if they can think it, you'll actually see that the motor neurons are actually working. So what hypnosis does is it allows you to envision an alternative future so that it actually starts to happen without it actually happening. But you're doing it without your conscious mind getting in the way, saying, how do I do this?
Yeah. Athletes use it all the time.
Yes.
In just that way, except they call it mind training.
Yes, yes. Like you said, we're doing it all the time.
All the time.
But why not do it with ourselves in the driver's seat? That's my take on it.
I use it with teenagers about the pain thing, who come in for anger management. I teach them to numb their hand with the power of their mind, and then take my nails and pinch it and turn it, and they're watching, and they go, holy smoke.
And they can't feel it.
They can't feel it, and then when they come out of hypnosis, and I say to them, if you can do that, imagine what you can do. You don't need to punch a hole in the wall. You can focus on your homework, because that's your brain. And they go, oh, that's cool.
You've empowered them.
They've empowered them.
And they've empowered themselves. That's right. You've given them the tools to empower themselves.
That's what's so exciting about this.
And to find their magnificence.
Their magnificence, that's right.
I love that. How did you come up with that?
I just woke up with it one morning and said, that's what I'm doing. I'm helping people find their magnificence. Because we are magnificent creatures.
See, that's another one. That's the dream. Dreams also are another road to the subconscious, just like hypnosis. Yeah.
We have a caller, ladies, that doesn't want to go on the air, so I'm going to ask the question for her.
Sure.
Tonight, the caller would like to know how to deal with teenagers that may be on drugs and marijuana. Any suggestions would be helpful. So I think that this would be like a general question. Dr. Tarman, take it from a general point of view, and then Dr. Cannon, perhaps we could talk about hypnosis. How to deal with teenagers on drugs and marijuana.
Oh, you mean as a family member?
Yeah, as a family member, possibly a mom trying to deal with teenagers.
Oh my gosh. The first thing that comes to mind is get support for yourself. You can't control your teenager.
No.
You can educate them, and then the key now is just how can you not get in the way of their own learning and take care of yourself.
Yeah.
That's
And get them away from their friends.
Yes.
Well, that's easier said than done.
Well, it depends. If you've got family living somewhere else, you know, ship them off to somewhere. Yeah.
That research has shown repeatedly that with teenagers, peer is much more important than parental guidance.
Yes.
So actually, thank you. That's very useful.
Get them away from the friends.
Yeah.
Yeah. If they don't want to talk about it, they're not going to listen. If they're already down that path, take care of yourself, as you said, Vera, and understand that that kid is going to do what they want to do.
How young can you hypnotize somebody?
I have a colleague who works with children of 3 or 4 years old.
And they're very easily hypnotizable.
Well, they're in imagination all the time.
Yeah.
Right? They're children. If you say, imagine there's a fairy right there sprinkling dust down, helping your pain go away, they will see it and feel it because that's where children are all the time. They're living in their imagination. Yeah, so children are great. But it takes somebody who's used to working at pediatric level to work with children. I work with teens from about 14 upwards.
But once again, that person wants to be there,
Yes.
whether they're an
Yes.
adult or a
Yes.
teenager. They have to want to be there,
Yes.
right?
Yes.
You can't drag them into the office.
No, although some parents do try for anger management. But once the kid gets it, they get so excited they want to keep coming back.
Once again, those tools of empowerment, right?
That's right, totally.
Yeah.
Boys come in for anger management and can you help him clean up his room? Girls come in for self-esteem and presentation skills. Really interesting, the difference. And girls bring themselves in, parents bring the boys in. Do you find the same?
I don't.
You don't see kids, okay, yeah.
One of the big subjects that we have dealt with over the years is pain management. And there have been many, many differing views right here on our set, and very helpful things. But sometimes it's one of the most difficult subjects I find to talk about and to help people. In the area of hypnosis, tell me and tell our viewers about possibly dealing with pain management and what hypnosis could do for them.
An ethical clinical hypnotist will not touch pain management unless they have a doctor's letter, a physician's letter, to say it's okay to do this. Because understandably, pain is the body saying, excuse me, I need help, right? So we have to be very careful. We reduce pain, we don't get rid of it.
Okay.
Because the body needs to have a little nudge to take care.
Yeah.
Well, yeah, your body's got to know, and it's got to send you signals that it's in trouble.
But you can numb your hands. I taught my aunt, who was 83 at the time, who had arthritis in her knees, to numb her hands and then bring the numbing down to her knees. So she'd sit there like this, just feel good, because she was getting rid of the pain.
Which was possibly arthritis or something.
It was
like that.
arthritis.
Wow.
Yeah. It didn't last forever, but it gave her 3 or 4 hours of respite.
Gave her some relief.
Gave some relief.
Yeah.
So she did that herself. She learned to do it herself.
Yeah. So that's very important. So there must be a letter from the doctor.
Yes, absolutely.
Okay. So this would be like chronic pain, then perhaps from accidents or falling or something like that.
Yes.
Where they're receiving care, but perhaps this might be one more tool.
One more tool to use.
But you know, like and
birthing pain for sure.
Yeah. I'm just thinking now, like in some of the more up to date hospital clinics, like burn clinics. I don't know if it was you who told me this. At Sunnybrook, for example, that they use hypnosis for people when they initially come for treatment for burns. And it's been shown that people who have had hypnosis in that first period of time do much better with their recovery than people who don't. Because that power of suggestion is really, really influential in terms of
rebuilds the cells.
Yes, the regrowth of cells, and also the actual experience of pain itself. So it's acknowledged well enough that it's part of their protocol.
And Princess Margaret uses it for cancer.
Yes.
And chemo, the nausea that comes with chemo.
Yes.
So as I mentioned off the top of the show, one more tool for that recovery toolbox. And it's amazing how it goes over many areas of life, doesn't it?
Anything your mind touches.
Yeah.
Right?
It must be very, very rewarding work.
It's it's awesome. It's humbling, but it's awesome.
Yeah.
Because everybody has a story.
Yes.
And everybody, when they get it, when they understand the power of their own mind, they get a light behind their eye, and it magic. It's beautiful. It really is. It's extraordinary.
And I can tell that you're a fan because you had the ladies call in earlier this evening, and the work in hypnosis is working, obviously.
Yes. I told them to call in that hypnotic script last week.
Oh, you did not.
No, I did
not.
No,
you didn't.
I did not.
Good story, though.
Yes,
it's a good story.
Tonight, my panelists have been Dr. Vera Tarman from Renascent and also Dr. Georgina Cannon. She has written a book called Return Again, of which you can get on her website at georginacannon.com. Just before we take our final break, I just wanted to do a little shout out to a very key and wonderful member of our production crew. Our wonderful Joanne is a production assistant here. She keeps us on time and keeps this show rolling along with Jeff, our director, and Denise, our call screener. But Joanne's going off to have a baby.
Oh, lovely.
And we're all very excited for her, and tonight is her last show. So we just wanted to send you a big hug, Joanne. Thank you for everything that you've done for Living Clean, Living Well. Thank you from all of our viewers, and you've really made a difference. You know, this show, it's on late at night, but boy, oh boy, everybody's hearts that work on it are bigger than whatever, because we just love what we do. So all the best to Joanne. We're going to be back with final thoughts right after this.
I've had numerous opportunities to get into addiction counseling over the past 5 or 6 years. This one at New Awakenings really appealed to me. First off, the facility here. We've got a swimming pool, there's a gym downstairs. Other side of the fence, golf course. It's fantastic, and the food is, world class. The staff cover all aspects of recovery. These are people with extensive experience in the field, all with the sincere desire to be helpful. If you want a shot at recovery from drug and alcohol addiction, New Awakenings is your best bet. Give us a call. We'll get right back to you.
What an interesting discussion tonight on hypnosis. I'd like to ask my panelists tonight for their final thoughts. Dr. Georgina Cannon, you may go first.
Okay. Please, please don't underestimate the power of your mind. It is magical. It is extraordinary in the way that it can accomplish anything that you choose to do. Remember truly who you are. You're amazing.
And you're going to find your magnificence.
Find your magnificence.
Don't forget about Georgina's website and her book, georginacannon.com. Dr. Tarman, your final thoughts.
Well, just along the same lines, with addiction is a very powerful unconscious motivator, and I'm so excited about the tool of hypnosis because it counteracts that by essentially counteracting your own magnificence, the own power of your own mind. So it's a way of reclaiming power that addiction has taken away.
Wonderful. Thank you so much, ladies. I have truly loved this discussion. It's interesting to bring in, as I said, another tool for that recovery toolbox, and it's been great to see how it can also have ramifications in all of our lives. That's it for now. Our guest next week is Dawn Slesser. I'll see you then. Good night.
Living Clean, Living Well has been a presentation of the Canadian Centre for Abuse Awareness.